Greetings, everyone, and thanks for viewing this presentation on the Trust for America's Health's Age-Friendly Public Health System Recognition Program. We're delighted that you're here today, and we understand that you're here because you want to learn more about TIFA's revised recognition program. And we hope the information that we'll review today will be helpful for you, but please always feel free to reach out to Karan or myself. Next slide, please. So when we think about healthy aging, we want to understand kind of what that means. So this model was developed to highlight the basic components that are needed for healthy aging. And it's really at the core of these areas, promoting health, social engagement, and addressing social isolation and optimizing physical, cognitive, and mental health. So most models of health and healthy aging at the public health level do not necessarily include an older adult component. So TIFA set out to ensure that healthy aging is elevated to become a core public health function. And that's what the recognition program is all about. Next slide, please. We feel like public health departments are so well positioned to participate in meeting the needs of older adults, not to take over, but to participate. And we learned from COVID that the public health role is crucial, especially in the ongoing COVID response and then in the recovery. So some of those public health roles include, of course, preventive services and screenings and other quality health services, but also meeting some of those social needs like ensuring access to healthy, affordable foods, making sure that older adults have opportunities for physical activity, including things like balance classes, and learning about education and the balance of energy needs, tobacco and substance misuse and prevention, social and emotional support, which is so important because of the exacerbation by COVID of social isolation and loneliness, violence and abuse prevention. We're coming to understand how much that has worsened because of COVID, whereas about 10% of older adults were being mistreated prior to COVID, that's up to over 20%. And those are just the cases we know of. And then also providing access to safe, affordable housing, as well as transportation. These are all needs that we feel like public health can participate in, can provide, and can connect and collaborate to ensure access. Next slide, please. So many departments of health are already engaged in activities to support older adults and promote healthy aging. So to further incentivize these efforts, TIFA designed a series of 10 action steps that we thought were key to making the transformation to becoming age-friendly or to have healthy aging as a core function. So this was our original recognition program, was based on 10 action steps, and we're very pleased to report that at least one state Department of Health, New York, and several local health departments did complete the original recognition program. Next slide, please. But TIFA recently revised our original 5 C's framework to include a 6th C, and to ensure that all of these components have a foundation in health equity. The newest of the C's is at the top there on the left, creating and leading policy systems and environmental changes to improve and support older adult health and well-being. Then, to ensure alignment across the initiative, our AFPHS initiative, we revised the recognition program so that rather than completing those original 10 steps, health departments can select activities within each of these 6 C's that better meet the unique needs of the older adults in their jurisdictions, whether that's a state, county, territory, tribal nation, city, or community. We're hoping that this new alignment provides not only greater flexibility, but also honors the engagement of those of you who have already begun to work to incorporate healthy aging into your functions. Next slide, please. So what you see on this slide is an outline of the new tiers of our recognition program. And we've got 3 tiers, as you can see here. The first one focuses at an individual level. It is designed to create leadership and support the building of capacity, almost like a professional development opportunity. So we want to designate you as an AFPHS champion if you have attended or viewed 6 of our AFPHS trainings, whether they are current ones, and we have one coming up every 3rd Thursday. I was almost going to say tomorrow, but some of you will be viewing this as a recorded event. The 3rd Thursday of every month of our trainings, and then you can find the previously recorded trainings on our AFPHS website, that's afphs.org, and go to the Recognition Program tab, and you'll see there will be a link there for you to connect to previous trainings. So if you attend 6 trainings, you will be designated an AFPHS champion, and we at TIFA will keep track of that so we can email you and let you know. The next tier of the program is departmental. Again, we want to honor engagement, but we also think that there needs to be some commitment to this work. So the requirement to become an AFPHS recognized department is to submit an action plan that lists at least one activity within each of the 6 C's. And Karan, in just a moment, is going to show you the action plan and then go through a series of examples within each of the 6 C's. And I will tell you that if you or someone in your department has become an AFPHS champion, you have already met the requirement for the first of the 6 C's, which is policy, systems, and environmental change. And then the 3rd tier is the AFPHS Advanced, also a departmental designation that recognizes that you have actually gone in and made those policy, systems, and environmental changes by completing the steps in the action plan that you submitted, and that should be done within 2 years of submitting that action plan. So I hope that that's clear. Karan's going to, again, show you that plan and then walk through some of the activities. Karan?
Thank you, Megan. So this is just a snapshot of our action plan. It highlights, again, our new step, which is the creating and leading policy, systems, environmental changes. And again, this template is available on our website, again, AFPHS.org, and you download it and you complete the form. There's 6 blocks for the activities that you've completed related to each of the 6 C's. You then submit it to us, we will review it, and then we will hopefully be recognizing you as recognizing you through the program. As Megan already mentioned, and I just wanted to highlight again, if you attend 6 of our trainings, you've already completed the first step on the template. So you can simply note that, or you could, again, choose to complete it in another way. And I will highlight some of these activities momentarily. So the first C is, and again, the newest one, is creating and leading policy, systems, and environmental changes to improve older adult health and well-being. So again, this really focuses on addressing social determinants of health across the life course. And this is helping leaders to plan and work towards long-term sustainability and having an infrastructure to support age-friendly public health systems. So we've highlighted one example. Again, this is just one example. There are many, many ways you can complete this step of a program that created a multi-generational park in Florida. And again, this example highlights the ability to support neighborhood improvement by incorporating sidewalks, paths, and recreation areas that support older adults. Our second is creating and convening multi-sector stakeholders to address the health and social needs of older adults through collective impact approaches focused on the social determinants of health. Public health can leverage skills by connecting and being stakeholders. So again, how can you bring together various sectors from a system of different groups that are disjointed? You can also have a focus on prevention and community-wide improvements and enhance and build on new and existing partnerships. So here we've highlighted an example of a multi-sector collaboration. It's a coalition in Miami-Dade that brings together different partners to, again, focus on the overall goal of health in the community and increasing awareness of the aging and lowering the rates of chronic diseases in our community. So third, we have coordinating existing supports and services to help older adults, families, and caregivers navigate and access services and supports. to avoid duplication and promote an integrated system of care. How can we create a system where people can easily navigate and easily access resources? Public health can address the barriers to effectively offer community resources by identifying gaps, increasing access to services, and avoid, again, duplication of efforts that already exist. So here we're highlighting an example in Virginia where a hub has been created. And again, it's called the No Wrong Door, where you access this resource and this tool, and you can gain access to thousands of other programs, other professionals, and connect to other resources and get answers, all by accessing this one main resource initially. Now, fourth, collecting and analyzing and translating relevant and robust data on older adults. Again, we know the importance of having accurate and reliable data, and many examples can be highlighted here, but calling attention to this helps to highlight the needs of older adults in different communities. Synthesizing data provides stakeholders and participating parties with information they need to monitor risk factors and target efforts to those that are most in need. So here we have highlighted the Massachusetts Healthy Aging Collaborative, where you can go in and view different community level profiles at across the state. Our fifth step is communication related. It's important to communicate public health information to promote and support older adult health and well-being, including conducting and disseminating research findings and emerging and best practices to support healthy aging. So again, how are you disseminating information? How are you communicating with people in the community? Proper channels of communication can aid in promoting health behaviors and help caregivers to create healthy aging in their communities. So here we're highlighting just a screenshot of a video created by Seminole County in Florida that they're disseminating information about their initiative related to Healthy Seminole. And again, this could be a Facebook page or a radio ad or any other forms of media. And finally, we have our last step around complementing existing health promoting programs to ensure they're adequately meeting the needs of older adults. Many communities have existing public health programs that touch on a wide range of health issues, but it's important to make sure they're aligned with the broader healthcare system in addressing the needs of older adults. So again, existing programs need to be considered. And the best way to do that is create an inventory of programs and share those resources with older adults via some method, whether it be a hub or a newsletter, a website. And here we're highlighting an example from Fairfax County in Virginia, where they've created a community health dashboard where you can log in and see all of their resources and different programs that exist, again, to highlight and complement what they have available for older adults. So I know the first question we always get is, how do we get started? It really does not require much, little to no funding. In many cases, it's no additional funding is required on your part to get started. And it does not require additional staff. Again, if you complete the 6 trainings, you are already identified as a AFPHS champion. So you're already designated as a leader for AFPHS in that regard. And again, we are also available to help and support you as you go on this journey. We will set up one-on-one calls with you to walk through any questions you may have about completing any of the outlining steps. All the resources that we have mentioned, including a more detailed guide with examples of various activities that you can complete to achieve the 6 C's, is available on our website under Recognition Program on the menu. And the template, an example filled out template, and additional examples are available on our website. And again, here's our website and our email address if you have any questions or would like to talk with us one-on-one about the program. We look forward to receiving your action plans.